Momentum Autism Services are helping families of children who need a little bit of extra support. And today on Morning Live, we are going to learn what it is they do here and take a tour of their St. Catharines location. Good morning, Sabrina.
Morning.
Thank you for having us here.
Yeah, thank you so much for coming out.
Is this a school? It looks like a school. And what can you tell us about it?
Yeah, so we are an ABA therapy center.
What is ABA, Sabrina?
ABA therapy is applied behavior analysis.
Okay.
And what that looks at is it's an evidence-based approach, and it's really the gold standard of treatment for kids with autism, but then also other developmental disabilities as well. So what it looks at is it looks at teaching replacement behaviors and new skills, and then also reducing some of those challenging behaviors that families might see as well. So what we really strive to do is teach social skills, communication skills to really help children thrive.
How do you do that, Sabrina?
So it's a really structured approach. So it's really looking at skills that the kids currently have, and then goals that families have to work on. So we look at teaching those skills in a structured environment like this, where rooms are set up as classrooms and therapy rooms. So they're working one-on-one with an ABA therapist to work towards those goals. So whether it be communication, social skills, early academics, we do that through a systematic and structured approach.
Do you have to be diagnosed to come here?
You don't need to be diagnosed to come here. We do work with families who have diagnoses and who also don't have diagnoses. It is funded by the government as well. So once families receive that OAP funding, they can also access our services, which help with the cost. But again, you don't need to be diagnosed for that.
Well, coming up, we're going to take a tour. You said you have multiple rooms that serve different purposes. So we'll show you that, take a tour, and talk a little bit more about all the great things you're doing here.
Awesome. Thank you.
We're at Momentum Autism Services in St. Catharines. We'll be back. Good morning. We're taking you on a tour at Momentum Autism Services. This is our St. Catharines location. We have Sabrina here, and you're taking care of us, and you're our tour guide.
Yes, okay. I'm your tour guide today.
All right. We're starting with what room here? Now, you have multiple rooms, and why do you have different rooms, Sabrina?
Yeah, so this is our gym. We set these up really purposeful for transitions, working on those transitioning skills for a reason. A lot of kids do struggle with transitioning from preferred items to non-preferred or different activities. So we have these fun gyms to go to, or fun spaces to go to with their peers, to do some of those group activities and not just have to stay in the one classroom.
Of course. Okay, next room.
This is our rainforest room.
It's so lovely.
This is a fan favorite. So this one is a traditional therapy room. So you have your tables in here. Up to 4 students can work in here at a time. This one's for some of our kind of grade 1, grade 2 level students, I would say.
Okay, on to the next room. I'm loving this.
This one is our Lego room. So it's really set up to work on those fine motor skills. So if learners are coming in here to build blocks, to do different fine motor activities, you can kind of see them all over on the shelf there. So this room is again set up for a transition to come in here to do those activities.
Right.
And then our next one is our art room. So lots of fun activities in here. We have kinetic sand, we have Play-Doh, we have a water table, different activities. So again, the kids are coming in here together to work on these skills. They can also come in alone. We have some really artsy learners who like to hang out in this room specifically.
Well, it sounds like you're covering all the bases: physical activity, creativity, learning social skills for teens, setting them out into the community, and also just living at home, getting through a normal day, right?
Yeah, and that's the great part about ABA is that we're working on 15 to 20 skills at a time. So our sessions are around 3.5 hours long, but we're working on so many different skills. We're not just working on one thing in repetition. repetition. We're doing it in different environments, different situations. So again, they're really learning that skill.
And if anyone's just tuning in, what is ABA?
ABA is applied behavior analysis. So it's an evidence-based approach. Everything we do is data-driven. So we track everything that we do with data points, and we analyze that, and we look and we see how our learners are learning, and if they are, if we need to adjust things as well.
Okay, let's end up here with the calming cove.
Yes.
I already feel calm walking in here.
My favorite room.
Would there be a set time of the day that a learner would come in here, or is it just whenever you feel it's time?
If a learner requests it, we really want to work on their communication, so honoring those requests, coming in here. Also, our therapist might bring them in here if they're it's that time that they maybe need that desensitization.
Just a moment.
Yeah.
Just a moment. As you know what, Sabrina, we all need that.
Exactly.
On a daily basis. And I think we all need a room like this.
Yeah.
Well, thank you so much. We have more to come here at Momentum Autism Services in St. Catharines on Ontario Street. We're back at Momentum Autism Services. This is our St. Catharines location, and we are in one of the many classrooms here, Sabrina. Yeah. Can you tell us about this room?
Yeah, so this one, we call it our Zoom room. So this one is for some of our earlier learners, and it's set up like a classroom. So we have a cozy corner, and then we have our individual tables that the clients would work at with their therapist.
How many students would you have in here at a time? Should I say students or children or?
Yeah, students, learners.
Learners, okay. How many at a time would you have in this room?
Typically, so this room can hold up to about 4.
Nice.
And then sometimes there's only 1, sometimes only 2, just depending. But it can hold up to 4 students. And then we have it designed to have like our whiteboard on the board so that the kids can sit on the circle and have circle time. So this one was purposely kind of created as a classroom.
Okay.
To work on some of those classrooms.
Can you run me through what you would be doing with the learners?
Yeah, so these are some of our visuals that I have. So these are just an example of some of the things that we would work on with them. So we call this a token board. So these token boards we use to help indicate to our learners when certain activities are available. So we have fun little creative ones. We try and individualize everything for our learners here. So we have cars, we have food, mommy finger, daddy finger, if you're familiar with that nursery. So again, we use these to kind of indicate to our learners what's available and to remind them of what they're working for. We also have a visual schedule. So this is just one of our many examples of what we might use to indicate to our learners, again, what they're doing next. So this helps really build in routines. It helps them understand the structure and give them that autonomy to, again, kind of select what they want to do and move through that.
And are these things that they would apply at home?
Yeah, so we work with families to have these also transition to home. We collaborate with schools, so schools are using these as well.
Wow.
So if they're learning it here, we want to make sure they're doing it in all environments as well. So we'll make these with families, send it home. Same with token boards. Same with again, a visual board of what options they have available. Because sometimes our learners don't know. We just say, "What do you want?" But they don't know what they want or what's available.
Right, or even how to express it.
Yes. Yeah.
Right, and this looks kind of straightforward.
Yeah, this is just one of our inset puzzles. So again, we just use these activities to really work on skills. So the goal with ABA therapy is a lot of times to parents it looks like just playing, but it's really not. That's what we want it to look like, because the more comfortable a child is, they think they're just coming here to play and have fun with their friends, but the more comfortable they are, the more they're able to learn. And as they're learning, they're actually developing so many new skills that we see.
And quickly, what would this be for?
This is one of our timers. So again, we really want to use these strategies before behaviors or before the child may experience some uncomfortability or frustration. So this is what we would indicate to them to let them know how much time. And again, it's a really good visual for them to see, okay, I have 5 more minutes left, rather than using those phones and other things. This is just a visual that we can put on the table so they know what to expect.
Okay, well, thank you, Sabrina, for running us through this room. And we have a little bit more to come here at Momentum Autism Services. This is their St. Catharines location. You can check out their website, and we'll be back with a little bit more. And we're in the team room now at Momentum Autism Services on Ontario Street in St. Catharines. Sabrina, thanks for welcoming us here and teaching us a little bit about what you do. So the teen room, what goes on in here?
Yeah, so this is our teen room. So we have a lot of teens and older kids that like to come to the center as well. So our teen services are really cool because we can work on some of those real life skills. So as you can see here, we have a group table, so our teens will work on social skills together. They're working on some self-regulation programs together. So that's a really exciting environment in here. We again have it set up like a classroom, so we have our cozy corner where they can play games, hang out if they need a break. Our teen services aren't also just limited to our center. We also have home-based and community-based services.
Wow.
So home-based and community are for all ages, but really our teens, again, it's really unique to this area to have the ability to go into the community with the therapist and work on skills. So whether that's job interviews, whether that's volunteering, and working on some of those, again, real life scenarios, going to the store, going to restaurants and purchasing and sitting and eating in a restaurant, those are all things that we work on and we program for within our services.
Sabrina, is there a minimum or maximum amount of time that a learner would spend here?
So typically our sessions are 3.5 hours. For our older teens, it can be a little bit shorter, again, because they have the school day and things like that. 3.5 hours, one session a week is our minimum, and then we don't have any minimum number of like time that you
Okay,
need to
like
be
an
with
end
us.
date. Yeah. Do you come across any stigmas or misconceptions of autism?
I find there's a lot right now going out in the world, but it's really, I think it's shifting. There's so much going on. People are learning more. People are researching, doing their research, and again, I think it's really important to talk to medical professionals. You know, make sure that yeah.
Right, and as you said earlier, you don't need to be diagnosed to come here.
Right.
But it is helpful.
Yes.
So if there's anything you could say and simplify a misconception of autism for anybody watching, what would that be?
Well, so what you said about the diagnosis, right? Our wait list is so long to even be diagnosed. And then by the time you're getting diagnosed and then receiving funding to get the services, it's not accessible right now. So that's why Momentum really does try to be accessible. So we have options. We work with families. To kind of answer your question about the misconception, I would say, you know, once you meet one person on the spectrum, you only meet one person on the spectrum. Right. It is such a wide range, and I'm sure you've seen some of our kiddos today, right? They all have their own strengths. They all have their own goals that they're working towards as well.
Well, you're doing great stuff here. And for anybody watching at home, if you have a child, a teen that needs support, reach out to your website. Is that what they would do?
Yeah. So our website is momentumabaservices.com. Okay. There's a form on there that they can fill out, and it goes right to our referral department.
And do you take phone calls?
Yes, we do. 905-381-3333.
Okay, well, we'll get that number up for you, and that's on your website. Thank you so much, Sabrina. It was great to meet you, the staff, and all the great learners here.
Yeah, thank you. Thank you for coming.
Much.